Lung surgery. Definition. Lung surgery involves the removal of lung tissue to repair the damage, perform a biopsy, to impede cancerous growth, or the removal of extraneous material such as fluid buildup or blood in the lungs. Lung surgery is surgery done to repair or remove lung tissue. Purpose. Lung surgery may be performed for one of several reasons. To perform a biopsy of lung tissue in case any abnormal growth is suspected. To drain fluid buildup from the chest in a lung surgery procedure called pleurodesis. To remove a part of the lung if it has been infected by cancer. The lung operation can be performed to remove a portion of the lung, an entire lung section known as a lone or a complete lung. Breathing normally with one lung is possible. To drain blood from the chest cavity after trauma such as an accident. To replace a lung in case no other lung surgery procedure can give results. To remove pulmonary blebs and prevent the collapse of the lung. Conditions that require lung surgery. The surgery is performed for any of these pathologies if recovery through medication is not possible. Bronchiectasis involves recurring infections in the bronchial regions. It may cause scarring or thickening of the bronchial wall and may reach a point of severity where the condition is no longer treatable by drug therapy. This condition causes patients to be highly fatigued, have bad breath, extreme coughing, and cause eventual weight loss. Interstitial lung disease. Scarring of the lung tissue can cause extreme difficulty in breathing and may have underlying factors such as asbestosis, pneumonitis, connective tissue disorders, or idiopathic pulmonary fibrosis. Lung cancer. Cancerous tumors would require a biopsy to be performed, necessitating an initial lung surgery. In case the tumor is ascertained to be treatable by radiation therapy, a further lung surgery procedure may be avoided. However, a lung operation may be determined to be the best way forward for patients whose cancer has progressed beyond the initial stages. Lung nodules. These are benign growths on the lung tissue, which may not always require surgery. A lung operation will be recommended by surgeon in case the nodule is found to be blocking airways and hampering the quality of patient life. Blebs. They are small cavities where the air is trapped between the lung surface and its outer covering, and a rupture in a bleb can cause the lung to collapse in severe cases. In some patients, pulmonary blebs may form close together and fuse to create a bulla. Collapsed lung. It is a condition caused most often due to trauma resulting from a penetrating wound such as a fractured rib, a knife or bullet wound, and in rare cases, cigarette or drug abuse, or lung disease. The pneumothorax or lung collapse may be treated by a lung specialist without open surgery, in some instances, inserting a needle to remove air pressure and a chest tube. More critical cases involve lung operation and prevent immediate death in cases of extreme trauma. Emphysema. Emphysema means that the alveoli are damaged and will weaken the lungs, causing a lack of sufficient oxygen and rapid breathing. It can occur without apparent symptoms, but if shortness of breath with unexplained fatigue is felt. Right candidate for lung surgery. Most lung disorders do not require lung surgery. As a patient with respiratory problems, he may be provided with courses of antibiotics, pain medication, or recommended breathing techniques to ease discomfort. Only a small percentage of patients with lung disorders and cancer are recommended for lung surgery. Depending on lung function, type of disorder, cancer, location of the tumor, lung surgery history of patient and family, type of cancer and stage of metastasis, a patient may be declared as a candidate for lung surgery. Methods of lung surgery. The two major ways that lung surgery procedures are performed include thoracotomy. A lung surgeon makes a cut in the chest wall to access the lung tissue that needs to be repaired or removed. This is a more traditional method and it's also known as open surgery. It is an invasive procedure where the rib cage is separated or a rib is removed, and the entire procedure can take between 2 to 6 hours, during which the patient is sedated under the influence of general anesthesia. Video-assisted thoracoscopy surgery. This type of lung surgery procedure is designed to be less invasive than open surgery, and helps with quick recovery. A lung surgeon makes small incisions in the chest wall through which several tubes are passed, one of them being a video camera with high-intensity light, to aid in the surgical removal of lung tissue. This lung surgery procedure is also known as keyhole surgery, due to the size of the incision made, as well as laparoscopic lung surgery, named after the camera device. Usually, the recovery time is drastically reduced for a WETS procedure when compared to a thoracotomy since the wounds are smaller, and most patients observe that they can return to normal routines much more quickly after laparoscopic lung surgery. These two processes can be used to remove all or some portions of a lung and can be classified as below. Types of lung surgery. Pneumontomy, removal of an entire lung, irreversibly damaged either due to cancer or through scarring, is known as a pneumontomy. Removing an entire lung through a lung surgery procedure requires thoracotomy, and is used as an extreme measure after possibility of all other lung operations have been excluded. It is possible to live a normal life after a pneumontomy with adequate rehabilitation. Lobectomy. Human lungs are made up of 5 sections, with the left lung having 3 sections called lobes, and the right lung having 2 lobes. A lobectomy lung surgery procedure involves a lung surgeon sectioning off and removing one of the lobes of the lungs to ensure that no airways are blocked, or so that cancer does not spread to other parts of the lung and the body. A lung surgery procedure involving the removal of 2 lobes from the lung is also known as bilobectomy. This may involve removal of lobes from both lungs. Wedge resectioning. This lung surgery involves removing a portion of the lung when a lobectomy is ruled out. Usually used to remove tumors, the wedge resection procedure involves sectioning off of a portion of a lung lobe that carries that cancerous growth, instead of the entire lobe. However, the chances of the cancer returning with a wedge resectioning procedure is higher than that of a lobectomy. Segmentomy. This type of lung surgery involves the removal of certain portions of the lung with the blood vessels such as veins and arteries passing through them, without removing a complete lobe or wedge. Sleeve resectioning. If the cancer is growing on or near the bronchial tubes, the lung surgeon will section off the affected part and reconnect the tube through this lung surgery procedure. Lymphadenectomy. A lung surgeon may remove lymph nodes from the lung area if they suspect the possibility of cancer in them. This lung surgery procedure reduces the possibility of recurring cancer and is most often followed by radiation therapy. Precautions to take after lung surgery. These include simple measures such as getting adequate rest, discipline with regards to regular exercise and diet, quitting smoking and removing self from the proximity of smokers and smoke, regular follow-ups in the hospital. Complications and risks. The complications from lung surgery procedures commonly involve pain, which is managed by medication, and the following factors as well. Air leaks. If an airway is inadvertently damaged during the lung surgery procedure, an air leak that is not completely closed becomes a serious complication. Damage to surrounding areas, an incision on a blood vessel, such as a major artery or vein, or to an undamaged part of the lung can happen. This is a very rare situation, however, and it can be treated by a lung surgeon who is highly specialized and comes with experience in lung surgery. Infections. These are a more common risks, and with some varieties of superbugs becoming immune to medications, sterilization during the lung surgery procedure has to be completely ensured. Low tolerance allergies to anesthesia. Since a lung operation is performed under the influence of general anesthesia, it is necessary to ascertain the patient will not face complications during surgery.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.